If you're ever in an accident and bleeding out, when the ambulance comes, you're not going to ask the EMT who was driving the other car and what was their mistake and how the accident happened. You're just going to want them to kind of stop the bleeding and get you to ER, right? In the same way, we are in a pandemic. Here are the things that you want to know about the coronavirus and the things that you don't want to know right now, and you can worry about them later. Hi everyone, I'm Pallavi. People call me Pals. Welcome to Pals Lives Life. Here are things about coronavirus that you want to know right now. The first thing is that it's a brand new virus. Of course, all of you know it by now. None of the human population has immunity for it. Like, even if you have been playing in dirt and whatever nonsense, you still don't have immunity for it. There have been videos circulating about, the closer you are to Earth, the more immune you are to this virus. No, you might be able to fight it off a little bit better, but it is still going to affect you. Those who are vulnerable and have some underlying conditions, it's going to still affect just the same as someone from a first world country who has never been in dirt. They are going to need all the medical services that they need. In fact, people from Wuhan who have recovered from this virus are showing signs of a second infection from this virus. So basically, we as a human population and all, and the scientific community as an all, don't know what exactly this virus is and how it progresses or mutates or does to our human body in a long run once you're affected. So it is a brand new virus and we don't have any defense against it as of right now. The next point is that it does transfer asymptomatically, which means that even if you have no signs of being sick, you still might have the virus and you could be transmitting it. Same way, someone else might look completely healthy and could transfer the virus to you, and it can take up to 14 days for the symptoms of this virus to be apparent. In fact, there has recently been a video where an expert is saying that you cannot use symptoms to diagnose this virus at all because the symptoms are really diverse. It's like 20% of the population gets fever, and then 80% of the population gets something else. So symptoms are not the best way to diagnose this virus. So you really cannot know who has just a common cold or simple flu and who has coronavirus. So your best defense right now is just to stay away from anyone. And why? That brings us to the next point, which is it has so far shown to have 8 different strains, which means the virus has possibly mutated 7 different times if it started as a single strain at the very source. So the more immune systems that a virus encounters, higher is the chance that it's going to mutate. So the best defense is to not present that many bodies in general to this virus. The next mutation might be in your own body, and you might end up transferring this new strain of coronavirus to the next person, or it might end up mutating in a way that it gets you sicker than it has ever gotten anybody in the past. So the best defense again is to not present as many bodies to this virus and just avoid getting this infection as of right now. As of now, we have no cure for this virus. Here is kind of, a list of treatments that have been tried out on coronavirus. That includes even the hydrochloroquine and the treatment for HIV that have been tried as experimental treatments. Scientists and doctors are desperate. Even the latest convalescent plasma treatment, where they're taking plasmas from the people who have recovered and trying to inject it into people who are seriously sick with the virus. It is an experimental protocol, and the fact that FDA has approved this protocol on such a short notice means that even they are grasping at straws and they are trying everything that is in their hands, which means there is still no known cure for this virus. Any of these treatments that have been circulating on the internet, they are not cures for this virus. I am a hardcore believer of Ayurveda and I have been practicing it pretty much all my life. My grandmother practiced it pretty much all her life. So it's been in my family for generations. But I don't believe there is a treatment. There might be some little solutions that can fight off the usual flu that you can try here. But there is no known cure for this virus. The next thing that we thought in the beginning was that it only severely affects elderly and immunocompromised people, which is not the case as of now. It has shown to get those who are healthy severely, severely ill. In fact, one of my friend's husband is in an ICU. He is a very healthy 40-year-old and he is in a dire condition. They are trying the convalescent plasma treatment on him as of now. And this is actually the reason why I'm making this video, because this is very serious. There are no treatments and you don't want to be in his position. So honestly, right now, social distancing and quarantine are literally your own defense against it. It is not for those who are sick or elderly, and you might say that I am not sick or I'm not elderly, but it's not for other people. It's for your own sake that you want to stay indoors and not get this virus. As of right now, there is no treatment, there is no immunity, and as of now, we know that it can affect people of any age with or without any immune deficiencies. This virus has been known to survive in the air for up to 3 hours on copper, up to 4 hours, up to 24 hours on cardboard, and up to almost 2 to 3 days on plastics and stainless steel. And that is because what this virus is. This virus is a little strand of RNA which is covered or protected by lipids, which is basically fats, and then it has these spike proteins that are kind of jutting out on the side, which help this blob of fat attach to human cells, and that allows the RNA inside the fat to travel into the human cell, and that is the only place it can multiply. So if we get rid of kind of this outer fatty layer, the RNA is not protected anymore and the spikes are incapable of transferring that RNA into the human cell. So whatever degrades this fatty layer is our defense. So wash whatever might be exposed with soap, and then the RNA is just kind of left out there to dry out, and there's no way for it to kind of do this hooking process onto human cells. So wash your hands, wash your clothes as soon as you come from the outside, wear masks, and disinfect your surfaces as much as you can. Anything that would kind of get rid of this fatty outer covering. Because there is no known cure as of now, this is what we can do at home. So drink a lot of hot water very often, and if that is in future turns out to be a possible defense against the virus, you have already been doing it. Drinking hot water has no harm. If anything, you would end up improving your skin, but besides that, there's no harm in trying that. So definitely give that a try, but it is not a known cure or treatment for this virus. Know that in your head, but you can still give it a try. So what's the bottom line? This is a highly contagious disease. We have no immunity for it. There is no cure for it. It is currently a pandemic. Our hospitals are not equipped to handle it. And who's paying the price? It's our doctors and nurses, the people that we are going to need the most when we get sick. So the only way for us to help them out is to try and flatten this curve with social distancing and wearing the masks and doing what we can from our end, and giving them time, giving scientists and researchers the time to come up with a treatment and a vaccine and test out the vaccine and give it to us. But for that, we need time. You need to survive till that thing comes out. If you're dead before that, it's of no use to you. So, right now, all you can do is survive. Now, here are the things that you honestly don't need to know. Where did this virus originate? Who brought it into this country? What animal did it come from? Did it start in the wet market? All that information is doing right now is just spread hate. The last thing that we need, the last thing that our community needs is hate. Once this pandemic is over, we can deal with all those questions. Scientists who are looking for possible cures can deal with all those questions. Us as normal human beings in our houses who are kind of protected by this outer shell, our house, we are lucky to have a home. Those that are homeless don't really have this defense system. You are lucky if you have a place which you call home. You are lucky if you are not going every day into the cesspool that are hospitals right now and then coming home worried that you are infected and you're possibly going to infect somebody in your own house, possibly your child, your husband, your parent. So if you don't have to do that, you're actually lucky. So count that as a blessing. stay indoors. Those who are currently sick with this virus, my prayers go out to you. I hope you feel better soon. Those who are recovered from this virus, see if you can find a place where you can go and donate your blood that is being used to either treat the patients and then also for research to figure out what might be a good treatment against this virus. If you can do that, you are doing a great service to humanity. And thank you again for doing that. Thanks again for joining me here. If you like this video, don't forget to give it a thumbs up and pass it along, because there might be somebody else who might be helped with this video, someone who doesn't have this information. I hope you stay safe until this thing is over. All right, see you guys later. Bye.